Welcome, everybody, to our next installment of Impilo's webinar series addressing challenges with patient enrollment and engagement for remote patient monitoring. Just to let everyone know, this webinar is being recorded and will be sent to everyone who registered, but is also here today as well. We're happy to have you here with us today, and I want to start off by introducing ourselves. My name is Chelsea Ebling, and I'm with the marketing department here at Impilo. And this is my lovely colleague, Danny. Danny, do you want to introduce yourself?
Absolutely. Thank you, Chelsea. Hello, everybody. My name is Danny, and I lead the implementations team here at Impilo.
Amazing. We're so happy to have everyone join us for today's topic. And real quick, we're just going to go over the agenda. So I'm going to go over who is Impilo for anyone who is joining us for the first time, not really familiar with our company. Then we'll go into the importance of patient enrollment and engagement, addressing some key challenges. We're going to talk about some strategies for engagement. Then we will go into how Impilo can help. And then we'll end with a Q&A where we will be able to answer any of your questions. So feel free to pop your questions in the chat at any point during the conversation. If it's relevant to what Danny and I are talking about, I'll just go ahead and answer it right then. But we might just wait until the end. So depending on when you put your question in, we will answer. So let's get started. So I'm going to start off by introducing Impilo for those of you who are joining us for the first time. So Impilo strives to make clinicians our first priority so you can make patient care your number one priority. We enable health organizations to bring healthcare into the home with connected device operations. Our plug and play platform can enable the use of RPM devices, supplies, and sensors. We also provide tech-enabled support services, logistics, and an API infrastructure to enhance virtual offerings. All right, I'm now going to pass it on to Danny to discuss the importance of, patient engagement. But before we get there, do you mind going into a little bit about what is patient enrollment, what is engagement, and what that all means and how important it is to remote patient monitoring services?
Absolutely, Chelsea. So, in the world of remote patient monitoring, enrollment is known as the moment where you identify that a patient has a need to be enrolled in a specific program to monitor their condition, and you get their express consent to be able to enroll them into that program. And that we have essentially with the purpose of getting their permission to be able to bill the CPT codes to Medicare or their insurance, right? So that is what's known as the enrollment process. It is a combination of some documentation that needs to be signed or some verbal consent that needs to be provided, as well as some education into the program. Engagement is more known as, think of it as the patient journey, right? Like the entire journey from beginning to end is how we keep the patient's interest and make sure that they are adhering to those program expectations that have been set with the purpose of A, improving their clinical outcomes, and B, being able to maintain a sustainable program, RPM program, or otherwise.
So awesome. And, thanks for that overview. I think that's a great way to get this webinar started. And in your experience, Danny, why is patient enrollment and engagement so important in an RPM program?
Chelsea, the most important thing to think about is at that enrollment phase, helping the patient understand the purpose and why you're wanting them to enroll them into that program is going to be really, really determinant on their engagement down the line and their motivation to stay in the program, to be adherent, right? So that is why enrollment is very, very particularly important. It will have an impact on clinical outcomes because, again, it affects that motivation of the patient to take certain number of readings so that you can calculate the averages appropriately. So that you get the doctor can see the different trends for that patient. And overall, the success of the program, right? Just from a billing perspective, being able to capture the number of readings that are accurate or adequate for the billing purposes is also going to be a part that that is very, very linked to the enrollment piece. Now, for engagement, it's very similar, right? So a successful enrollment leads to a higher possibility of having better patient engagement. But then sometimes you just need to rekindle the relationship. You just need to find certain things to support the patient to continue to enhance those clinical outcomes and ensure the program is being successful.
Awesome. And now that we understand the importance, I know that there may be some challenges in patient enrollment and engagement. So do you mind, going over that with your experience, like what you've found?
Yes, absolutely. So obviously, with all of this, I think in healthcare presents a lot of barriers, but being able to bring this to the home, it brings a lot of advantages as well. But like you mentioned, there's going to be certain things that are going to make the process a little bit more difficult or present certain friction for the patient to be able to kind of go, in depth for the program. So the first one is time, right? Time from the clinician's perspective. Whenever you go into a doctor's office, I'm sure you've seen the MAs and the registered nurses are focused on clinical care, providing lab work, providing, very important things at the office. And being able to sit some time to fill out some documentation, to walk the patient through a specific app or a specific technology and onboard them onto that might be a hurdle, right? So many times what we see or what our customers have told us is we don't really have the time to enroll the patient and to educate them on the program. So when they leave the office, they might not have the full understanding of what they're signing up for or what those expectations are, right? And like we already covered, enrollment is going to be key in the success of the program. So I think that's like the chief complaint that we've observed with some of our customers. I think the secondary complaint that we see a lot and oftentimes they ask us for guidance on is how should we do this outreach, right? Like, should we just prescribe it to patients that are seen in office? Should we be looking at eligible patients? Should we be contacting them, sending them letters, mailers, text messages? What exactly should we be doing here? And in our experience, you need to really understand the demographics and have some available time to test different strategies to be able to define what that outreach strategy is, right? So that is a secondary challenge that we've seen, our partners go through. And then the final one is, how do you keep the patient engaged? So once you've spend some time educating the patient started to be on the program, they are seeing, results, they're seeing that you are or the physician is getting the clinical information to determine their health plan. Now, what do we do at that point to maintain that relationship and make sure that that patient doesn't burn out, doesn't get tired of taking their readings at specific times, right? Or that if they went on a vacation, that they come back and they, continue to manage that.
Sure. Wow. Yeah. Thank you for, going over all of that. And I think everyone who is looking to start an RPM program probably has all of these challenges. And, with your experience in these challenges, what have you found to really overcome these hurdles with what you had just mentioned?
Right. So of course, for the specific one that we just mentioned in terms of like time, there's really nothing other than hiring additional staff or outsourcing this to a company that could be, very specific about this. But let's say that you have the time, you have the availability to be able to do all of this. There's three main strategies that I've seen a lot of success with, and the first one is really understanding your patient population, right? And really not, and what I mean by your patient population is not just as an aggregate, right? But understanding each individual patient and their motivations. Because imagine, Chelsea, that I tell you, okay, Chelsea, now you have to take 3 readings 3 times a day at this times, and you've never taken a reading.
Yeah.
before, right? That could be really overwhelming for you to take a device home and maybe you don't even know how it works or what to expect. Perhaps you have some type of routine in your life that will prevent you from following this. So how can I come in and impose this instead of knowing you and understanding that in your particular lifestyle, we might want to build up to building that specific habit. And right, that's the secondary initiative that we found very successful. It has been the tracking of those habits and the supporting of those habits, right? So Chelsea, if I were to ask you instead, hi, Chelsea, I'm so glad to have you in this program. Tell me what your day looks like. I would love to understand how your day looks like. Tell me about your morning. And I find out that you wake up every day by clockwork at 9 a.m. You take your medication, you take your dog out, you do certain things. And then I understand a little bit of like what maybe your concerns are about taking those 3 readings at those specified times, and we can together build solutions for this. And maybe the first week you take 1 reading, right, consistently at 9 a.m. when you're taking your meds. And then the second week, I go and ask you, Chelsea, how did this go, right? How did this process work? And we go until we build that whole framework around your lifestyle so that you can solidify the habit and you can, lead to those positive outcomes down the line. And then with that, obviously, when you know your people and you've built a program to support the habit tracking, you will have to establish a solid outreach strategy. So you'll need to learn, again, from a population perspective and from an individual perspective, what works best, what types of nudges and reminders you might need to send out to these patients, when those nudges should happen, what else should happen during those times that you are speaking to patients. As you know, in remote patient monitoring, oftentimes the patient has contact with their care coordinator, right? And those calls are very specific to what's going on with the patient's health. It goes in depth about their habits, their health habits, regarding nutrition, regarding exercise. But what if we had a separate call where we're just dedicated to like engagement and that additional support, and we learned a little bit more about the patient and how they prefer to communicate with us, how they prefer to have certain reminders or nudges, like I was mentioning. So I think the combination of those 3, I think it's like a waterfall if you think about it. And you know your patient, you help them establish the habits, and then you have a very solid outreach strategy so that when those habits are starting to be a little shaky, you then have that possibility to bring them back, send the nudges that are going to be effective for that population.
Yeah, wow, those are really great strategies to increase engagement. And I know just personally, like that habit building is such a difficult task when you are just so set in your ways and you need to add one more thing to your routine. And especially if you can develop a solid outreach strategy that will allow you to sort of be someone's cheerleader on, making sure that they're taking their readings and making sure that they're following through with the program is just going to kind of like a waterfall effect, like you mentioned, just all these things just really help, have this be successful for the patient.
Absolutely, yes.
Yeah, so thank you for going over that. And do you mind just going over a few ways on how Impilo can help with these challenges?
Yes, absolutely. So as you mentioned, when you were introducing Impilo to everybody, we take everything, we take it from a bird's eye view, if you will, to allow the clinician or the customer, the program, to really focus on the clinical pieces, right? So we got to remember Impilo has insights into everything that's happening once the patient has been enrolled. We know when a device has been shipped. We know when it has arrived. We know when a device stopped transmitting. We can even know specific things like whether the device is running out of battery or if it has like a not so strong of cellular signal, right? So by knowing all of this, we can allow physicians and clinicians and people who are running these programs in staying focused on patient care alone, right? And driving those outcomes that we were mentioning. Take that information that they're getting and turning it into a positive health plan, turning it into a positive outcome. That is, the first thing that we do. And again, going back a little bit into that high level view of the patient journey and tying it into what we do about we learn the population, and we know exactly what the best strategies are to reach out to them. So by knowing when those milestones are occurring, we can deploy strategies that are going to support those outcomes that we want to achieve. For example, if we know when an order has been placed, we can send an automated message to the patient letting them know, like, hey, we're so excited, the order is on your way. And we can kind of nurture that path forward for the patient, right? And then I think the final thing that we do ultimately, because we are face to face with patients, just as a clinician is we really learn about the patient population and the mix of the demographics that we've been given. And this doesn't mean that every customer has one demographics. It could mean that it could vary from one campaign to another, right? But essentially, just a thing like thinking about location or thinking about a specific trigger like age, right? We could devise certain strategies and support our agents in training for those skills, right? Through objection handling, through engagement strategies that we can use. So we really take the time to understand the patient, and then according to that, build some personas and help our team understand and train those for those specific occasions.
That's awesome. Very helpful. Yeah, so if anyone has any questions right now, make sure to get them in the Q&A. Some have already, came in. So Danny, if it's okay with you, ready for some questions?
I'm super ready, please.
Awesome. So it looks like the first question is, how can someone identify which patients will benefit most from RPM?
That is an excellent question. I think there's two ways that typically are either the physicians or the program managers would identify this. It's very important to go back into what the requirements are for someone to be deemed eligible, right, for a program. So if you're launching a remote patient monitoring program with a focus of to monitor blood pressure, you will need patients who have been diagnosed with either hypertension or hypotension, right? So the first thing to do is evaluate your current roster or cohort of patients to understand how many of my patients have suffered from this condition. It could be hypertension, it could be diabetes, it could be obesity, right? It could be any chronic condition that you want to manage. So you can look at the diagnosis, and then you can look into the patient's history throughout the time with you as a clinician, right? And be able to, from there, really understand whether or not that patient might be eligible. And like I said, there's different strategies. The first one is you have the patient in front of you, they have the diagnosis, they're telling you that they're tired of taking medication for blood pressure and that they want to, like, maybe see if there's another way to manage this chronic condition, right? And at that point, the first thing that comes to my mind is, yes, well, you can't come off medication yet, but maybe there's a way to titrate your medication. If I had more information on when those spikes are occurring, how these are presenting, right? So I think that's the first way to identify them. And a lot of our partners also look at their EMR and they run reports to understand, again, their demographics and see who's eligible, and start, with our help, targeting those patients for education to see if that's something that the patient is excited or would want to enroll in.
That's awesome. Thank you for answering that. And I know that we were talking about some of the challenges, some of the strategies. So what metrics should, practices, health organizations should track to measure patient engagement success?
Right. So again, the first thing that I want to make a distinction is perhaps the metrics are going to be different for enrollment than they're going to be for engagement. So I'm going to focus first on enrollment, which is the first part of the journey. But for enrollment, you want to understand conversion rates. You want to understand outreach results, right? So if you evaluate a campaign specifically, you want to know what was the rate at which they answered a certain email campaign. You want to know the rate at which patients called interested because you deployed a mailer, right? And from there, start to do some success metrics on their own to solidify your campaign strategies. And then the ultimate success metric there is conversion of those patients that were eligible. How many was I able to get interested in enrolling into my program? And on the patient engagement piece, there's more information that we can get, because then you'll want to see how many like what's the time between the order placement or when you gave the device to the patient and their first reading. That is going to tell you perhaps how interested the patient is and how many patients get activated within the first 3 to 5 days of receiving their device. The secondary thing that you might want to track for engagement is going to be the number of readings on average that a patient takes, right? So for the requirements, we know we want to track 16 days of readings per month, right? So knowing that your population on average tracks 22 days versus 13 or 12, right, will tell you what type of strategies you might need to deploy. Then there's other metrics that are a little bit more advanced into looking into the amount of time that you're spending speaking to these patients, right? And how effective your care coordination conversations are going to be. So those are some success metrics that you can utilize. And of course, there's more. there's many things in this world that you can be tracking to, again, understand and know your population. But off of the top of my head, I would say that those would be the most important.
Okay, that was very helpful to kind of have an idea of, how to measure success, because I think that's important in, RPM programs is how do you measure success once you get it started?
Right.
Um, so let's see if there are any other questions. Let's see. So, have you guys ever had to deal with language barriers? And if so, how is that handled?
Yes, absolutely. We have that happen often with different demographics. So depending on our partner's preference and the requirement and need, we offer either the standard package of having that specific language within the agents that we use, or alternatively, there are some translation services that are available to us for whenever it's like a one-off, right? So you didn't know that the patient spoke Vietnamese or Chinese or Russian or something like that, and we don't have anyone on our team at the time to do that. We can support them through the translation services.
Good to know.
Yeah,
I think that's really important.
absolutely.
Um, so let's see. I think we have time for one more. So let's see. Um, how do you handle device replacement or troubleshooting if a device stops working?
This is a very good one because oftentimes, patient engagement is very tied to this. I know I didn't mention this area perhaps earlier, but if technology starts failing or the patient loses confidence in the technology, you are going to see a drop in patient engagement, unfortunately, right? Like if you think about it, 15% of the patients that drop off on a specific month, the cause behind this is technical troubleshooting and the fact that the patient couldn't really be bothered to deal with that, right? So as I was telling you, Impilo provides that bird's eye view to understand, okay, when a patient stopped taking readings, we can proactively manage that. We can see, again, a cellular network, or if it's an issue with the battery, and we can proactively launch some strategies to reach out to the patient, right? That is one of the things that we do. But on the other side, what we do when we are enrolling a patient and when we're building that relationship is we walk the patient through how to reach out to us and show them that it's really simple to troubleshoot their device and that they don't have to completely give up. A lot of people, the first thing that comes to mind is like, I'm not good with technology, not understanding that the cellular devices are so simple as just take your reading and it's going to come to us. You don't have to do anything else. But of course, if there's an error, right, you can always reach out to us. And so Impilo works with the different customers that we have to think through what device replacement strategies they'd like to deploy based on their goals and how flexible they are in providing those replacements. But oftentimes when a patient says, I want my device replaced, and we've done the extensive troubleshooting and just to make sure that everything is working correctly, the way that we handle that is we just provide the patient with a new device, send them an RMA to ship it back to us. We do some testings, and if the device is failing, we can send it back to manufacturing. Or if the device is actually working correctly and it might have been just a user error, at that point, we can simply refurbish it and put it back in the customer's inventory.
Amazing. I think that's so important to have a plan for all of that to happen because technology can be finicky as much as I love it.
Yes, for
So,
sure, for sure. And it's such an area, Chelsea, where you really don't want to like to argue too much with the patient about, because it's
sure.
it's it's how they're feeling about this, right? It's like the device just won't work, and you're
Yeah.
like, "Oh, we did troubleshoot through empathy, we troubleshot through like different ideas to make this happen, but if you put a lot of resistance at that point and you don't have like a quick and easy solution for the patient, that is going to definitely affect and cause the patient to drop off the program."
Yeah, absolutely. So that's definitely important to have a plan there and glad that we can help, health organizations kind of take that, stress away from them so they can focus on the clinical care rather than having to troubleshoot a device.
It's absolutely.
Awesome. So we are going to wrap things up. If we didn't not get to your question, I see a few in here. If we didn't get to your question, I'll make sure that we answer it outside of this. But thank you all for joining us today for our webinar on addressing challenges with patient enrollment and engagement. If you have any questions that pop up later today, later this week, next week, a month from now, feel free to reach out to us at sales@impilo.health. And of course, if you are interested in learning more about our offerings and solutions, feel free to reach out to that email as well. Again, that is sales@impilo.health. Once this session ends, there is going to be a brief survey. So I would definitely appreciate you all filling that out just to let us know how we're doing. And also, if you are interested in any topics that you would like to see covered in the future, definitely feel free to put that in there. And I just want to say that we appreciate your participation and thank you for joining us, and we will see you again soon. And also, thank you, Danny, for joining us today.
Of course, I'm really happy that I could be here. And like Chelsea said, please, if there was anything that we didn't answer, we will get back to you as soon as possible with some responses.
Absolutely. All right, everyone. We'll see you next time.
Bye.